day and welcome to ProLab.
In just a short while, your medical examination will begin.
For you to have a smooth flow of our medical procedures, here are some very important reminders. First, make sure that you have your health card together with your company identification card. Fill out the medical examination report form. You may ask our medical staff where to get one. Second, proceed to step 1. This is the registration step. You have to submit your filled up form and show your health card and company ID. After this, you may now proceed to step 2, which is the blood extraction step. In this phase, our medical technologists will get blood from you either from your finger or through your vein by performing venipuncture, depending on the amount of blood needed for the specified test.
Complete blood count or CBC gives important information about the kinds and numbers of cells in the blood, especially red blood cells, white blood cells, and platelets. A CBC helps health professionals to check any symptoms such as weakness, fatigue, or bruising. A CBC also helps to diagnose conditions such as anemia, infections, and many other disorders.
After the blood extraction, you may ask the medical staff for containers for your urine and stool specimen. Please be advised that women with menstrual period are not allowed for urine tests. Please inform our medical staff if you have so. Urinalysis, also called a routine urine test, is used to check for abnormalities in the urine. A number of diseases and conditions can result in abnormalities in the urine. It is done to screen for early signs of diseases such as kidney disease, diabetes, urinary tract infection or UTI, protein in the urine or proteinuria, and blood in the urine or hematuria. Urine is also used to diagnose pregnancy. Fecalysis or stool examination is useful in diagnosing of many different conditions such as diseases of the digestive tract, liver, and pancreas. Also, it is used in determining the cause of symptoms affecting the digestive tract, including prolonged diarrhea, bloody diarrhea, an increased amount of gas, nausea, vomiting, loss of appetite, bloating, abdominal pain, and cramping. It is also used in screening for colorectal cancer by checking for hidden or occult blood. Stool examination is also used in detecting the presence of parasites such as pinworms, hookworms, and ascaris. Please submit your collected urine and stool before proceeding to the next step. Step 4 is for chest x-ray. Our x-ray technicians will advise you to remove any metallic objects around your chest area. Please follow the instruction from the x-ray tech while undergoing the x-ray procedures. Please take note that in x-ray, you will be exposed to a certain degree of radiation. So, if you are pregnant, please inform the x-ray staff because radiation is very dangerous for your baby.
Chest radiographs are used to diagnose many conditions involving the chest wall, bones of the thorax, and structures contained within the thoracic cavity, including the lungs, heart, and great vessels. Pneumonia and congestive heart failure are very commonly diagnosed by chest radiographs. Chest radiographs are used to screen for drug-related lung diseases.
After you undergone chest x-ray, you may now proceed to our medical doctors for your physical examination. You may ask any of our medical staff on where you can see our doctors. Please take note that there are doctors for male patients and another doctor for female patients. Physical examination or clinical examination is the process by which an investigates the body of patient for a sign of diseases. It generally follows the taking of medical history, an account of symptoms as experienced by the patient. Together with the medical history, the physical examination aids in determining the correct diagnosis and devising the treatment plan.
If you are 35 years old and above, you are subjected to our additional test. For male and female patients, you have to undergo electrocardiogram or ECG and plus a pap smear for female patients.
The electrocardiogram or ECG is a diagnostic tool that measures and records the electrical activity of the heart in exquisite detail. Interruption of these details allows diagnosis of a wide range of heart conditions. These conditions can vary from minor to life-threatening.
A pap smear, also known as pap test, is a medical procedure in which a sample of cells from a woman's cervix is collected and spread on a microscope slide. The cells are examined under a microscope in order to look for pre-malignant or malignant changes.
A drug test is a technical examination of urine, hair, blood, sweat, or oral fluid samples to determine the presence or absence of specified prohibited drugs or their metabolized traces.
A comprehensive group of chemical tests performed on the bloodstream. These tests includes blood sugar, total cholesterol, blood urea nitrogen, liver enzymes, uric acid, triglycerides, total protein, various electrolytes, and many others. Oftentimes, it requires fasting. If you are done with all the tests required for your medical exam, you can now leave your medical report form to step 1 and return to your respective work.
Thank you for making ProLab as your clinic of choice. Have a healthy and joyful day.
Until next time.
Goodbye. For more information about ProLab,
you may call on the numbers flashed on your screen.
or you may visit our website at www.prolabph.com.
You call it service,
We call it care.